Michael, and this is California. And right now, with the re-emerging pandemic and the potential second lockdown, there are a lot of people who are reaching their last week of health coverage through their work and looking at what are their healthcare options through the California Health Exchange, or as we call it, Covered California. Now, Covered California is specifically designed for people who are either permanently or temporarily losing their health insurance from somewhere else. So like from their work coverage or their spousal coverage, or maybe Medicaid or Medi-Cal, or even from their parents' coverage. This is because the coverage can be started at any time you lose your health insurance coverage and can be stopped at any time you go back to work. So it's not something you have to have for a set period of time. Now, one of the biggest concerns that people have when they're looking at their healthcare options is 1, how much does it cost? 2, what does it cover? And 3, and lastly, most important, especially for those folks who have ongoing care, is does my doctor or my doctors take the plan that I'm trying to enroll into through Covered California? Now, this last one seems like an easy question to find the answer, but in practice, it can be very difficult to figure out, especially if you have multiple doctors, like a primary care doctor, a PCP, and multiple specialists. This is because on the individual side, health insurance for people not getting health insurance through their work, there are a huge amount of different plan types, plan levels, and different doctors' networks, even within the same insurance company. Luckily, through Covered California, most doctors in California accept at least one of the private health insurance plans offered through the exchange, but not all of them. So today, we are discussing the different types of health plans doctors accept through Covered California and how to tell if your doctor accepts your Covered California plan that you're trying to enroll into. Now, before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. So let's talk a little bit about Covered California. So Covered California is a state-based health exchange that provides access to health coverage through private health insurance to anyone who lives in California, regardless of their income. So it includes plans like Kaiser and Blue Shield and HealthNet and Molina and LA Care and a whole lot more. Now, for folks who fall within the income guidelines, Covered California will provide subsidy or premium assistance to help ensure that the private health insurance plan costs are affordable. Now, the general income range for Covered California starts at 138% of the federal poverty level. It goes all the way up to 600% of the federal poverty level. So, for example, for a household of 4 in 2020, this would mean people's incomes between $36,000 a year and $157,000 a year could apply to get some help paying for their health insurance plan. Now, of course, if your income is low, you'll get more assistance and you'll pay less. If your income is high, then you'll get less assistance and you'll pay more. And if your income is below the minimum income amount, you can still submit an application through Covered California, but your info will be sent as a referral to your local county to enroll you into Medi-Cal unless you specifically request that it does not. Now, Medi-Cal is a government-run health insurance plan and is completely different from Covered California. And we'll save the Medi-Cal discussion for another video because there's a lot there. So in this video, we're only discussing private, non-government run plans that are offered through Covered California. One of the most frustrating things about trying to find a health insurance plan that your doctor accepts on the private market is that there are so many different types of plans. There are HMOs, which are health maintenance organizations. There's PPOs, which are preferred provider organizations. There's even something called an EPO, which is an exclusive provider organization. And each plan type will have their own doctors' networks, even if they are within the same insurance company. So, for example, if Blue Shield has a health insurance plan, they have an HMO and they have a PPO, and someone enrolls into either of these plans, they will not necessarily have access to the same doctors. This is because in many cases, doctors who are part of doctors' groups or operating independently will find that HMOs or PPOs or even EPOs work better with their medical practice and also pay doctors very differently. Additionally, doctors can come in and out of networks throughout the year, meaning that your doctor could take one plan at the beginning of the year and then at the end of the year not take that same plan or takes a whole different plan altogether. Now finally, doctors usually will limit how many patients they're able to effectively see. This is to ensure that they're giving the correct level of attention to each of their patients. So even though a doctor takes a plan, they may not be accepting new patients because they already have too many patients to take care of. So these are just a few quirks of the individual health insurance market. And you may experience this when you're trying to find out if your doctor takes the plan that you're looking to switch into through Covered California. Some networks are harder to figure out than others. And in general, HMO networks that also provide healthcare are easier to figure out if your doctor will accept your plan or not. This means insurance providers like Sharp in San Diego or Kaiser, who are also affiliated with the hospital networks under the same names, and they tend to have a more stable doctors list. This is because the doctors in these cases are actually employees rather than independent doctors who contract to accept the insurance for healthcare services. So for example, if your doctor is at Kaiser, then you must get a Kaiser plan in order to see that doctor. You could not get a Blue Shield plan, even if it's less, and still be able to go see that Kaiser doctor. So the drawback is that you're only able to see a doctor within those hospital networks. But if you wanted to go to another doctor who is outside of Kaiser, then you would not be able to do so with your Kaiser insurance. Now on the flip side to this, it could also be that if you have Kaiser and you have a Kaiser plan, you don't really have to worry about if your doctor is in network or out of network. If you go to a Kaiser facility, they're going to take that Kaiser plan. So that makes things a lot easier. On the other hand, if you choose a PPO plan, you'll have a plethora of doctors to choose from. And most doctors in California will accept a PPO plan. But the issue is that not all of them are on the same network, especially if that doctor you're seeing is in a private practice or has their own office. So the benefit to a PPO is you'll be able to see a larger variety of doctors, from doctors at large hospitals all the way down to your neighborhood independent practice doctors. But PPOs have doctors networks that are in networks and out of networks. If your doctor is in network, you will pay much less than if your doctor is out of network. This can be the cause of a lot of frustration because the cost of visits from different doctors can vary wildly depending if they're in network or if they're out of network. And this is an important thing to keep in mind when you're looking at purchasing a health insurance plan through Covered California. So the big question is, how do you know if your doctor takes the insurance you're applying for or if they are in network or out of network? With our clients, we usually have a 3-step process to check the doctor to see if they accept the plan and if they're in or out of network. The first step that we do is to check with the Covered California Doctors Finders. So on the CCA website, coveredca.gov, and I'll put it down below, there is an option to put in your doctors and see which of all the plans that are offered through Covered California that they take. It's a great tool that will show you if all your doctors take one of the plans, or maybe some of your doctors take some of the plans, or maybe just one of your doctors only takes one of the plans. Either way, it's a good way to get that initial check out of the way. The second step is to check the insurance company's website. Now, each carrier will have a website with a provider search or a doctor search. And you can use this function to put in the plan that you're looking at and put in the doctor's list that you have, and you can see what plan they take, what network they are in or out of, as well as if they are accepting new patients or not. And finally, as a last step, we'll try to reach out to the doctor's office to check with them to see which plans they actually take. Now, this can be a little bit tricky because oftentimes you'll talk to the person at the front desk and they're not usually versed on the hundreds of plans they usually take. So you have to talk either to the billing department or the insurance department specifically. Overall, ensuring that your doctor is on the plan that best fits your healthcare needs can be a tricky proposition, especially because contracts, networks, and doctors move in and out of accepting insurance throughout the year. But if you use the CCA Doctor Finder utility and the provider search on your preferred insurance carrier's website, you can get a pretty good idea of whether or not you'll be able to see that doctor if you choose that health insurance plan. Thank you so much for watching our videos. I hope that you found them interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions, leave them down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can. Now also, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-Cal or even health insurance for a small group, we know health insurance. So if you have a question about your health care, you can leave those down below. We can help you with that as well. Now, other than that, I'm Michael, and this is California, wishing you a happy, healthy day.